Welcome to Voice TV Nigeria. My name is Zainab Ahmed. I'm your host for today's episode. As usual, we bring to you exciting news and entertainment. And not only that, we also fill your doorstep and your screen with so many exciting health benefiting episodes and programs. I'm not always alone on this episode. I'm with our renowned, able pharmacist, the person of Dr. Ben Amodu. He's someone who has helped alleviate the sufferings of mankind through the discovery of so many drugs which cure several diseases in mankind. And today we're here with a breakthrough, one that will baffle many in the discovery of a drug that can substitute for blood transfusion. I won't walk you through this alone, as we'll hear from the source directly. Welcome on stage, Dr. Amodu.
Thank you very much. Viewers all over the world, it is my pleasure to introduce to you an innovation that has just been approved and released by NAFDA in the blood-related area I've earlier been introduced.
This new discovery for mankind, can you walk us through it? What is it all about, and how do you think it will help alleviate the sufferings of mankind?
Well, blood is the life wire of all human beings and all living things. And because it is so, that endowed me and made me to focus on this research into the blood. And to God be the glory that that research has paid out with the listing approval I got on tonic, which is the first of its kind anywhere in the world. I say so because it has the capacity to replenish any blood within the shortest possible time, to the extent that it can be used as a blood substitute in accidents, in emergency use, and in various diseases. Various diseases, I mean, kidney issues have issues with low blood. HIV, low blood. Tuberculosis, low blood. Kidney end disease, low blood. Accident cases where there's massive blood flow, low blood. In the delivery, where mothers lose a lot of blood, blood is an issue. In antenatal clinic, blood is the issue. In leukemia, blood is the issue. In cancer of the breast, all forms of cancer, blood is a major issue. And I say this with all proudness, in the sense that with the addition of subtonic, you find the situation of breast cancer healing faster than it would have been without it. Okay. So this is what I did.
Okay, so for the benefit of our viewers who are watching us, you're trying to tell us that this particular drug which you discovered can cure so many diseases in a short while. Any related blood diseases, it tends to cure that disease.
Yes, exactly what I'm saying is that in most of these disease situations, blood becomes a major issue because there are shortages of blood running through all the disease conditions I have mentioned. Okay. And from experience so far, when they have been used together with this particular product, it's like an adjuvant in the treatment of these diseases. It makes the treatment of these diseases easier when it is put in the combination, because blood is a major issue in all these situations that I've mentioned.
While going through your research work, I also got to a place where I got to see that this drug can also help in curing sickle cell anemia. Walk us through this, please.
In fact, sickle cell is the major issue here. Okay. I just deviated to talk about the adjunct function of these products in those other related areas that lead to shortage of blood. You know, sickle cell, 5% of the entire world population carry the trait of sickle cell. And sickle cells are divided into two. There is it's a majorly a deficiency or a problem of the hemoglobin. And you know, hemoglobin is a very important aspect of red blood cells that carries oxygen, carries food material. Or the distinguishing factor between the red blood cells and the sickled blood cell The red blood cell is usually round and very flexible in shape and can flow. But the sickle red blood cell, which is moon-shaped or crescent-shaped, has a flexibility problem. And as a result of that, it can block all other small blood vessels, leading to a major pain syndrome, a major bacterial infection, a major necrosis, leading to death of tissues. So from this angle, you can see. And sickle cell, as a matter of fact, with the traits being carried with so much percentage in the world, the two mother and father, because it's of inheritance.
It's a genetic yes, problem, yeah.
They carry mutating hemoglobin within their system, and as they mate, they give birth to offspring that are sickle cell anemia and what have you. The other type of anemia is the thalassemia anemia, which is mostly found in the basins.
Is that genetic too?
Yes, all of them are genetic. Okay. Basin in the Middle East and in Asia, that is where it is. Whereas the sickle cell predominates in Africa, the tropics. It's very, very common in the tropics. And for all of them, they have similar issues relating to shortage of blood, and which leads to infection, it leads to pain crisis, and it leads to necrosis and what have you. In the case of thalassemia, you also have people not able to do without blood transfusion.
Yeah.
It is the background of this that the importance of this discovery, this drug discovery, is very, very critical. Because as patients are on this particular drug for sickle cell, I want to explain here what it does. I want to explain the mode of action for those who have been on it so far. One, while they are on it, the sickle cell,
does it really change the shape of the red blood cell back to normal?
No. What it does, as you continue this medication with other medications of our group, which eventually cures sickle cell, what it does, it reduces the level of the red sickle cell that causes the anemia. From month to month, as you do your test, you see it going down, and you see the hemoglobin building up to the extent that the entire anti-red sickle cell are cleared from the blood, and the hemoglobin reaches the maximum. You see the genotype change from SS to AS or to AA, as the case may be, without any operative procedure. It is the first of its kind, and it varies with different patients. The least we have had 3 months cure. Others can take up to 5 months. Others 6, 1 year, depending on your own body makeup. And this is justified by science. So science says what you react to may be different from what your husband reacts to. So on the basis of that, if your own takes 1 year, so let it be. If another person takes 2 years, so let it be. But the most important thing, as you start the medication, attacks reduces. The blood levels up. But more importantly, you must refrain from being bitten by mosquitoes, by anything that will lead to shortage of blood that usually orchestrates crisis. As a matter of fact, over 300,000 individuals every year in the world are delivered with this sickle cell anemia or thalassemia anemia. And it is very, very important, according to WHO, that they are managed by way of healthy foods, a healthy lifestyle, plenty water, the taking of fruits,
and even exercise.
Yes, exercise that has a lot of water content. They need to take vaccination. They need to take antibiotics because of the bacterial infection, and a host of other procedures as stress. They need to sleep well so that they reduce the stress and so on, because it can trigger off this something. But let me not overlook this. How did Subtonic come about? We work on Telepathia occidentalis and Toluqua to be able to come up with this product.
Okay.
And these are of Nigerian, of African origin. They are leafy vegetables that we've been able to modify it to give us this kind of over 80 to 90% blood boosting properties without side effects.
Wow.
Not even a single side effect.
Side effects.
And as an adjuvant in the treatment of accidents where there are massive loss of blood and so on, when you don't even have time to waste for
looking for a
donor
yeah.
donations that have to be passed through by way of checking the HIV status.
It will even take more time, but
exactly.
I think this will be a faster way to
hepatitis status and so on before injecting the time wasted can lead to death. So if you have this product straight away, it can be administered. And you can see all over the world, we are talking of blood bank, they need to donate blood, they need to conserve them. So with this coming on stream, for instance, I traveled to Port Harcourt, I was bitten by a malaria mosquito, came back, checked my PCV, it was 39. And I took this capsule in 2 days. When I went back to check, it was 52. That is my PCV. I had to even donate blood so that I don't have the consequences of too much blood in my system.
Yeah. Now, viewers, this is a mind-blowing research from our able pharmacist here. This drug does not only boost or help the immune system, it also helps increase the blood level in humans. So, like most conventional drugs, they tend to be a side effect related to drugs. This whole experiment is a mind-blowing research, and I think my viewers want to know more about
from the beginning, over 35 years ago, when I started my research on food we consume as human beings, and to the glory of God, even in the Bible, that He has created with their leaves as meat. So I am I've been able to walk through all this, and I have my happiness.
Okay, with regards to the constituents of these drugs, can you walk us through some of the ingredients used in bringing this to existence?
Yes, I have already said it. Our popular ugu, Telepathia.
The ugu,
Telepathia occidentalis is the major active ingredient to the glory of God, and then glycerin and Toluqua just added to boost it up.
Yeah, and there's this question I know, and there's this norm, a common idea of every man on the street with regards to sickle cell anemia. It seems to there's this belief that they have this recurrent joint pain, body pain, and most times there's need for bone marrow transplants. With this drug, do you think there will be need for such transplants for people who are suffering from anemia?
Well, as I have told you, we already have several cures without bone marrow transfer. My organization, even though I work with the University of Abuja as the Director Institute of Natural Medicine, our belief is in the use of natural medicine. But that notwithstanding, in the English model, they have the bone marrow transplant, which is a very complicated, not always available, expensive procedure.
So with this now, it can help reduce costs.
Not only the procedure is as costly as $800,000 per one patient. And you are talking about something that's less than 10 million in the total cure range. So which one will you prefer? A 40 million or something under 10 million? That has no risk at all. No risk. No operation, no nothing. So we shouldn't have doubting Thomases, especially that we have practical cure.
Yes, sure. So have there been any clinical analysis or any testimony that arises from the use of those drugs?
Several. They are on YouTube. Okay. There are several testimonies to this effect on the YouTube of those who have been on these products, and even a pregnant woman who reported for antenatal, and the blood was checked, and we can't do this procedure.
Okay.
She came and we gave her. 2 days later, she went to the, and when they troubled her and said, no, please, don't transfuse me. Check my blood first.
Okay.
And when they took the blood and checked, they found that it had level of 39.
Wow.
Say, what happened? Say, well, it's God. Actually, this is the product we gave. And within 2 days, leveled up. In fact, my sickle cell patient who came for review yesterday, when the mother brought, after using the first set of doses, and they were just coming, she decided to do a quick PCB test because that is what tells you what is happening inside. And she showed me, and I said, "Ma, how is your son?" He said, "He's doing very well." Before we started, his PCB was 17. And I said, "Ma, are you happy?" She said, "Very, very happy that
definitely.
This boy had never had a 20 PCB, talk of 26. And that I can see him because he came with him. Looking very healthy, he's doing very well, and what have you. And I expect that at the end of the treatment, there are so many people I treated that they got cured. I just don't see them again. That's when I knew that they are already cured. So, for those who are doubting Thomases, God has already created the basis of this natural medicine. So there's no need to doubt anything.
Okay, with no doubt or iota of doubt,
you
can boldly say this drug cures sickle cell anemia and can substitute for blood transfusion.
Madam, we have tested it and we have results. Okay. As time goes on, we will do our clinical trials boldly.
Okay. But
before clinical trial, not to allow for people to die. Okay. The world must be informed. People should know.
Definitely, knowledge is said to be power.
Exactly, especially when you juxtapose this with hydroxyurea, which is the main one they are using now, a chemical that has several side effects, compared to what we have that has little or no side effect at all.
Okay, having known the effectiveness of this drug, this I call it world breakthrough.
Yeah.
Have this been registered and approved by NAFDAC in Nigeria?
Yes, as a matter of fact. It has been registered by NAFDAC in compliance with their procedure, and the registration number is A7 1023. That is the NAFDAC number of this particular subtonic. A7 10023. That is the NAFDAC number for this subtonic. And we actually got 13 approval in 1 day.
Wow.
From NAFDAC. And to this, we are very, very grateful. And I don't think anybody has received such an approval in one single day.
That's true. So now we always compare this traditional herbal drugs with conventional drugs out there. What makes this subtonic drug more unique and effective than conventional drugs out there? There should be this unique tag. There should be this selling point of this drug.
The uniqueness is its ability to push the blood beyond human imagination and as quickly as possible. That is the operating word. Okay. It pushes the blood quickly beyond human imagination.
And not forgetting to add, you said it doesn't have any side effects.
No, these are food materials we have eaten for thousands of years.
Day, yeah.
What side effects will be there? How much of ugu would you consume to have any side effects? Okay. I don't think.
All right. Okay, with regards to the cost of this product, I always keep comparing it with conventional drugs out there for viewers out there who are interested in getting.
No, we have already said it. Okay. We are talking of a combo. Okay. We're not just selling this one. We are talking of a combo that resolves the totality of the issues that are involved. If the cost is so less compared to the conventional cure method of bone marrow operation, or even gene therapy, which is also one of the methods used in managing, as advocated by WHO. You know, when you hear people do arguments, we are of African origin, and if we have solutions to things, we should not sit down and start saying that we are waiting for WHO. WHO should also go around, nose around, and find what are new discoveries, and also help to promote such African countries. Not only when it comes from China, or it comes from Japan, or it comes from UK or US, that it should be accepted. I give you an example. When I discovered Sam Mal was tested against chloroquine and pyrimethamine, and it was found equal to them in terms of activity or better than them. And it's reported in the Indian Journal of Medical Research, which is over 150 years old. That is a very high impact journal.
Yes.
So why did WHO not say when Corona came out, Nigeria has one good product, this. WHO should listen to this program I'm doing and should also change. Where you have smaller countries coming up with discovery, they should also go and promote such discovery. Not for them to just sit down as Father Christmas or they own the whole world and look for only something that is technically that is coming out of complex labs.
Okay, coming to that, you talk about WHO and other drug-related regulatory bodies.
Yes.
Yeah. Do you think there will be any conflicts of interest arising from this discovery you've made?
Well, what conflict? It's a cure. It's already on the ground. The best they have is bone marrow transplant and gene. Those ones will not cost small money. So we always have the advantage. And cost-wise, we try to be careful because of we are using WHO principle. That why did WHO say go for herbal medicine? It is cost-effective. It's easily available. It can be assessed, and it can be found everywhere. That's why WHO is promoting herbal medicine. So they should continue to promote it in that manner, not suppress the use of herbal medicine because they are in league, they are in alliance with some highly placed countries in the world. As they promote their own, they should also promote our own.
That's a nice one. Viewers out there,
yes,
you could hear from the source directly the effectiveness of subtonic herbal drugs.
Yes.
It helps in anemia, curing for so many diseases.
Yes. It's an adjuvant. It's an adjuvant in the treatment of several diseases.
Okay. So, does it have any restriction, age restriction? Does it have any restriction with type of people who have certain condition in the past to use?
No, it does not. Okay. The important thing is age-wise, since it's a 300 milligram capsule, the powder can be brought out, and then half of it can be dissolved in warm water for children. And once they take it, they get very good results.
All right. Viewers out there, thank you for coming out today to watch us on this exciting program. Don't forget, Voice TV brings to your doorstep not just entertainment and news, life-saving programs. Dr. Ben Amodu here was also the sole body, or should I say the brain box, behind the discovery of the COVID-19 drugs, herbal COVID-19 drugs, and so many other diseases drugs out there, diseases like tuberculosis, hypertension, and many more. Conventional drug is out there, fine, but here is an easy way. Nature has blessed us with a lot, and they say ignorance kills faster. Exactly. So I think we should encourage such persons in the society, as he has helped in so many discoveries, in the discovery of so many drugs that will help alleviate health issues in mankind. Don't forget, I'm your host, I'm Zainab Ahmed, and we'll see you next time in our exciting episode. Thank you very much. Thank you, Mr. Ahmed, for joining us.
Thank you for interviewing me, and as time goes on, we will unfold the remaining drugs one after the other. And if there are any questions, I'm sure Choice TV will leave my telephone number so that
you get your questions answered and you get feedback.
Yes.
Thank you very much.